Good afternoon. We have to wait just a minute. Okay. All set? Okay. Good afternoon. Hello, Rhode Island. Happy Wednesday. Good afternoon to members of the press. I want to thank everybody for tuning in today. We're going to be here every Wednesday at 1 o'clock for the coronavirus press conference. There may come a time when we have to do it more frequently than once a week, but right now I think if everyone could just take a little time every Wednesday, 1 o'clock, to tune in, we will do our best to make sure you have all the information you need in order to stay safe and informed around the coronavirus. Also, as a reminder, you can sign up for daily email updates. You can do that at the governor's website, governor.ri.gov. I would strongly encourage you to do that, especially now we are talking about what's going to happen when the kids go back to school. Every Friday, that email will be dedicated exclusively to schools. So if you haven't done it, please sign up for an email, governor.ri.gov. Okay, we have a lot to cover today. I'll ask you to bear with me. We'll begin, as we always do, looking at the data. So I'd ask you please to put that up on the screen. Yesterday, we had 61 new cases, and very sadly, another 2 deaths. So, 61 cases, that's holding steady. Those are the kind of days we like to see. Obviously, 2 deaths is heartbreaking. I had the flags at half-mast at the end of last week to mark the fact that we've lost over 1,000 Rhode Islanders to coronavirus, and we still lose Rhode Islanders every single day. To those of you who are saying the virus is gone, we're through this, we're through the woods, the virus is going to disappear, I want to remind you that people die every day in Rhode Island because of the virus, and we've lost over 1,000 loved ones. It's not gone. It's here. It is here, same as it's always been. We've gotten better at dealing with it. And I would just remind you it's deadly, and I would ask you to be aware of that and follow the rules. Because if you don't, more people will get sick, more people will be in the hospital, more people will die. And these are loved ones these are our friends, family, and neighbors, and we owe it to each other to do the best that we can in order to protect ourselves and our family against getting sick. Okay, I wanted today is the day that my executive order for phase 3 expires. And so I'd like to take the next few minutes to talk about where we are in phase 3 and my plan around where we go from here. If you look at the data over the past couple of days, you'll see a small spike. Excuse me. Today is 61, but you'll see a couple of days above 100. Today we're back down to a below 2% test positive, which is excellent. But yesterday we saw more than 100 new cases and a percent positive of just above 3%. That's concerning. It's not alarming. It's not cause for panic, but it's not what we want to see. We want to be consistently below 100 and consistently below 2% test positive. So we are trying to understand why. Why is this? Why are we seeing this bit of a spike? What's it coming from? As I pledged to you, I never again want to shut down the entire economy. So from here on out, we want to be able to pinpoint what's driving the increases and pinpoint our response to it. So thank you to the incredibly hard work of the team at the Department of Health. They have spent the past week doing a very deep dive into the data and looking very carefully through the contact tracing of more than 4,000 positive cases. So a deep dive into more than 4,000 positive cases to try to identify commonalities and why we're seeing this bit of a spike. And there's one thing in that analysis which is crystal clear. We're partying too much. Social gatherings are too large and folks aren't wearing their masks. We have cases traced back to a house party with more than 50 people and no one wearing a mask, to a baby shower, to a large birthday party in a backyard, to a large birthday party at a restaurant, to pool parties greater than 25 people, no mask wearing, to a sports banquet. And in each of these instances, the patterns are exactly the same. People who know each other, friends and family, more than 25 people, not wearing masks, in close contact for hours, mingling close together, no attempt at social distancing, probably not using hand sanitizer. And we are finding that for each one of these parties, baby shower, pool party, party on a boat, party in a backyard, a celebration for a baseball win, a baseball team's win in a backyard, a barbecue. Sometimes we're finding 7 to 10 positive cases for each party. So if you're doing this, I need you to knock it off, because people are getting sick, people are dying, and it's unnecessary. Yes, it's summer. I know you want to have a good time. We all do. But I have friends now whose loved ones are on ventilators. Your right to have a party should not infringe on their right to live. We have to get people back to work. 114,000 Rhode Islanders still are on unemployment insurance. We have to get these kids back to school, and we have to get this virus stable. So if you are one of the people who's been partying on a boat, partying in your backyard, partying around the pool, 20, 25 people, no mask wearing, breaking the rules, I'm asking you to stop it, because you are the ones that are directly putting our state's success in jeopardy. And by the way, it's particularly true for folks who are between 20 and 30 years old. Not just that, but we also see that in the data. So I want to ask you please to put the slide up with the metrics that I follow before making a decision about whether we're going to go forward a phase or backward a phase. From the beginning, I have said I'm going to be transparent, fact-based, data-based, and let you know what's going on and why we're making the decisions we're making. So I'm going to do that right now. Today is the end of phase 3. The executive order is up, and so I have a decision to make. Do we go forward? Do we go backward? Do we stay where we are? I want to quickly remind you of the 4 metrics that we look at every time. The slide in front of you shows that we're in good shape on 3 of the 4 metrics. Less than 10% of our hospital capacity is full, which is far below our benchmark for moving forward a phase, so that's great. We're starting to see a slight increase in new hospitalizations, but we're still consistently below where we need to be, half of our benchmark for moving forward a phase, so that's very good. And our total hospitalizations have plateaued over the past 10 days at around 70. So while we would prefer to see a decrease, a plateau is great, is good, it's good news, and certainly we're not anywhere close to doubling. The 4th metric gives me and us some pause. The 4th metric is the R value, and you might hear about this on TV, R naught, RT, rate of spread, rate of infection, R value. Essentially, it's the number of people that one positive person infects. And we have said we want to see that to be 1.1 or lower. We had been below 1 for some time, and we have certainly been hovering at around 1 or 1.1. So, which means every person that's infected would, on average, infect 1 other person. That's where we want to be. We want to be below 1.1 if we're going to move forward a phase. Unfortunately, we're not there. In the past few days, we've seen that number increase. It's estimated to be around 1.3 or 1.4. And we believe that that increase is 100% directly attributable to social gatherings that are too large, with no mask wearing and lots of people close in contact. By the way, when the contact tracing team calls the folks who are at these social gatherings, they can't remember exactly how many people were at the party. They don't have the list of the names of the people who were at the party. It's these kinds of social gatherings that are really a problem. They're informal, they're not very structured. It's hard to get a handle on exactly how big they are, how close people were you wearing masks? It's a casual environment. They're causing a problem. We cannot move forward to phase 4 because of that. Because the R naught is not below 1.1. It's up at 1.3, 1.4. So based on everything and those metrics, it's clear we're not ready to move forward another phase. We also don't need to move backward a phase. Now the cases are stable, hospitalizations are stable, et cetera. So today I'm announcing that I'm going to extend phase 3 for another 30 days. I'll be signing an executive order keeping us in phase 3 for another 30 days through August 28th with one change. We're going to lower the social gathering limit from 25 to 15. And I hope you take that seriously. 25 to 15. So if you're having a birthday party or a baby shower or a pool party or a backyard barbecue or neighborhood gathering, no more than 15. Take it seriously. Social gatherings above that level are the source of many of our positive cases. And as I've said, it's just very hard. These aren't controlled, contained events. You know, in restaurants, by and large, restaurants are doing a good job. They take your name, they take your phone number, they do contact tracing, they enforce mask wearing. It's these informal social gatherings that are a problem. So I want to review what this means. All other phase 3 guidance remains in effect. Indoor settings, such as restaurants, have a 2/3 capacity with a limit of 125 people. Outdoor settings have a limit of 250 people, specifically for public events and venue spaces. We know that spread is less likely at these types of events, even with larger groups, because we just aren't seeing the same level of mingling, lack of masks, and close contact. Additionally, the capacity for catered events, and this in particular at this time of year is weddings, that's what's on people's minds, remains at 50 indoors and 100 outdoors. Now I want to say this, if you've already planned your wedding, you know, you have an outdoor wedding planned for August and it's a bit higher than 100, call us, call the Department of Business Regulation, and we want to work with you. If you're just above 100, if you can convince us that you'll have a proper protocol and keep folks safe, we're going to try to work with you to let you keep your wedding and go a bit above 100. We need to get people back to work. We need to allow our children and teachers to get back to school safely, which means we need to control this virus now, which means we're going to stay in phase 3, but social gatherings are now going from 25 to 15, indoors and outdoors. That I'll sign that executive order today and it'll go into effect. I'd like to take a minute to talk about bars, which I addressed last week. So when I began phase 3 and we allowed restaurants to open, including bars, I said that we were in the business of trying to help you get back into business. And we still are. But the fact of the matter is, we've been in phase 3 for a month and there's no excuse anymore for not complying. You know, the first week or two, you had to learn the rules. Folks really weren't sure how to do it. And we understood that. We've been at it for a month now. We've seen too many problems with overcrowding in bars. And so we're going to really start to increase our enforcement. And quite frankly, it's not fair to the vast majority of restaurants who are following the rules. So the grace period is over and we're going to start to get tougher with enforcement. If you're not following the rules, we're going to shut you down. Period. We have to. We're going to work with you so you can safely reopen, help you, get things in order so that you can reopen because we want you to be in business, but we can no longer take any risks. And the excuse of, I haven't figured it out yet, is no longer going to be any good because we've been at it for over a month. The biggest problems we're seeing now are in restaurants that have a bar and allowing crowding around the bar. That's how people get sick. I would say to you as an individual Rhode Islander, if you find yourself at a restaurant and you're in a crowd, you should leave. Get out of the crowd. That's how you get sick. If you're in a line, in a line for drinks, you shouldn't be. That shouldn't be allowed. Any crowding in any restaurant is where you get sick. It's not where you should be. So I just want to take a second to remind everybody the phase 3 guidelines for restaurants and bars. In phase 3, bars can't operate like bars. Bars should not look like bars. They have to look like restaurants. So if you own a bar or a restaurant with a bar, you have 3 options. Number 1, you can have a bartender, but no bar seating. You cannot have people sit at the bar and serve drinks. Cannot do that. Number 2, you can have bar seating for dinner, food service, but no bartender, because we can't have people close to the bartender. And number 3, you could have a plexiglass barrier between the bartender and the seated customers. Under no circumstances, period, no exceptions, can you have standing service. Someone has to deliver a drink to someone who's seated. And this is what we're going to really crack down on. This is very simple, folks. You cannot have standing drink service, period. It's a bright line rule. Don't do it. And we're really going to start cracking down on that. Drinks can be served, but people have to be seated and distanced away from each other and away from the staff. We'll be sending out more inspectors and cracking down on the bad actors. Last weekend, inspectors went out to just over 150 bars and restaurants across the state. Over a third of them didn't have sufficient separation between bartenders and customers. Over a third. A number of our inspections involved return visits to a restaurant with previous violations. There's just no excuse for that. A dozen of the visits were so egregious that DBR had to issue compliance orders. And for many businesses, that meant immediately shutting down the bar areas until we were satisfied that the rules could be followed. Starting today, we'll be publishing a list of these businesses at reopeningri.com. So if you're a member of the public and you want to know who are these restaurants that aren't following the rules, go to reopeningri.com and check it out. It'll be there on an ongoing basis. By the way, we also want to recognize establishments that are doing a great job, which is the majority, 2/3 or more. So we're going to be highlighting best practices in our newsletters and websites to acknowledge them for their hard work, but also to share their good ideas and creative ideas. If you are out and about and you see crowding at bars or standing service for drinks, help us out and call us. DBR, you can go to the DBR website, dbr.ri, or we've set up a line, 889-5550, 889-5550. Call us, anonymous tip, let us know. I will say this, last week at this press conference, I gave a similar message to bars. And after, we were deluged by calls from restaurants that said, Gov, please don't shut us down. We are following the rules. So here's my message to you. I don't want to shut you down. I want everyone to be in business. Massachusetts, Connecticut, other states, their restaurant capacity is 50%. I went to 2/3. I'm trying to get folks to work. I need your help. If you are following the rules, go to reopeningri.com and see the restaurants that aren't following the rules and help us get your colleagues to follow the rules. If it doesn't get better, I'll have no choice. We'll have to do what Massachusetts, Connecticut, and other places are doing and just cut back. And the frustrating thing about that is there's no need to. If we follow the rules, don't allow crowding, enforce mask wearing, do the keeping everybody's contact information, we should be able to keep going. I would say consider this almost like a last warning. We are going to do our part. We're going to increase our inspections. We're going to get tougher with enforcement. We're going to be quicker to shut down operations that are not even trying to comply. I'm asking the people of Rhode Island to do your part, avoid crowding, call the tip line, and I'm asking the Hospitality Association and other restaurants, help us do what you can to enforce the rules on your peers who aren't following the rules, because they're about to ruin it for everybody. And that would be crushing and doesn't have to be that way. Okay, I want to spend the rest of the time talking about schools, but by the way, it's all related, because if we can't get the R naught down and we can't get the virus in a good place, it's going to be harder to open schools. I would say this is a tough one. You know, getting schools ready is a tough one. I feel that as a governor, I feel that as a mother. You know, there's not a mom or dad out there who's not a little worried. Is it going to be safe? What does a mom want to do or a dad want to do for their kids? You want to do what's best for your kids. And the question is, what is best for the kids? So, look, we know that being in school is best for our kids. There's no question about that. We shouldn't even debate that. Obviously, children should be learning in school. It's better for their brain development, their academic development, their mental health, their physical health, their social lives. It's where kids ought to be. And we know our kids are struggling because they missed out on school. They had to. And we see it. We see it in immunizations being down, weight gain among kids, increased suicide attempts, increased depression. It's really tough. So should kids be in school? Obviously, of course. The question is, what's it going to take to make it so that they can safely be in school? And I think this is not that different than the analysis we did for childcare or even school sports. You know, the question wasn't, should kids be allowed to play sports? Of course they should. It's part of their lives. The question was, how do we do it so they're safe? And that's what we have to grapple with schools. And I'll tell you this right now, we're not going to let anyone go back to school in person if it's not safe. Won't do it. Not worth it. Not going to happen. But I'll also tell you this, we owe it to our children to do everything we can to get them back in school. And the question is, how do we do it safely to protect them and their teachers and their families? I want to begin by reminding you what we've done with childcare and the experience we've had, because we haven't really talked about it. So more than 2 months ago, just about 2 months ago, we reopened childcare centers in Rhode Island. So these are, daycare centers for our littlest kids. By the way, these children do not socially distance themselves. They do not wear masks. And anyone who's ever played around with 2, 3, and 4-year-olds knows it's hopeless to try to get them to socially distance. Having said that, we put in strict guidelines around group size, symptom monitoring, face coverings, cleaning schedules, drop-off and pickup protocols, and more. What I want you to know is it's working. You should breathe a sigh of relief that this is working. Child care providers have stepped up. By the way, thank you to child care providers. At first, they were scared to go to work, obviously. They've gone to work every day for months. They're amazing, they're creative, they're strong. Thank you. We have now more than 75% of our child care system open. We have nearly 8,000 children currently enrolled in child care and more than 1,000 adult employees who have been working for 2 months. During that entire 2-month period, over 1,000 teachers, workers, and nearly 8,000 kids, we've had a total of 12 positive cases among the children and 14 among the staff members. In every instance, We caught the case quickly. We closed the areas for cleaning. We tested everybody at risk. And we've seen only one outbreak in a center, which we immediately closed. We closed the facility. We sent in a team from the Department of Health to do testing and case investigations, ensuring that the majority of the students and staff did not get the virus. So for those of you who are wondering, is this even possible? I would just refer you to the experience we've had for 2 months with childcare and suggest that it is going very well. I have to thank Director Courtney Hawkins for her tremendous work. And I also want to invite all of you to join Director Hawkins and me tomorrow at 3 o'clock for our weekly Thursday 3 o'clock Facebook Live to talk more about what are the lessons we learned from childcare and what can we learn from that to make our schools safer when they reopen. I think it's important for everyone to hear. So if you're a parent, if you're a concerned parent, teacher, concerned citizen, you want to know what's it going to take to safely get kids back to school, I would encourage you to tune in tomorrow, 3 o'clock, Facebook, hear from Director Hawkins and myself. We'll probably have another, I think we'll have another pediatrician with us, and we're going to talk about it. Okay, we are scheduled to start school in Rhode Island in 5 weeks, August 31st. And as I said, our job between now and then is to work as hard as we can so that we will do that safely. It's a Herculean task. I spent an hour and longer than an hour this morning on the phone with all the superintendents. They're all pulling their hair out, trying to figure out how to do this. I think you're trying hard, and I applaud your work. It means we have to think comprehensively about facility readiness, transportation, testing, classroom structure, precautions for teachers, got to keep our teachers safe, staff. It means establishing clear criteria and guidelines and working with school districts to ensure that they're enforced. And it means having a plan ready to change on a dime if we see spikes. So I want to start off briefly by saying where we are here in Rhode Island. Last week, we had 630 new positive cases. That translates to 59 weekly cases per 100,000 people. 59, I want you to remember that, 59 per 100,000 in Rhode Island last week. Florida is at 358 weekly cases per 100,000. Louisiana, 326. Mississippi, 307. If we lived in one of those states, or Texas, or Arizona, or California, we'd be having a very different conversation right now. But if we can keep ourselves at about 60 cases a week or lower, we can have a reasonable, thoughtful discussion around how do we get children back to school. And by the way, 90 countries around the world have reopened schools. So we know it can be done. And many of them, they've opened schools, they've seen no spikes. So it can be done. The question is, what do we have to have in place in order for it to be done? So we have recently put together a advisory board of experts to help us just around schools. It includes Dr. Dennehy, a pediatric infectious disease specialist at Hasbro, Dr. Merrill, medical director for epidemiology and infection control at Rhode Island Hospital, Dr. Sharfstein, who's a vice dean of public health at Johns Hopkins, Dr. Weddle, former dean of Brown School of Public Health, and Dr. Ashish Shah, director of Harvard Global Health Institute and incoming dean of Brown School of Public Health. I name their names because they are volunteering for us and working very hard, and I want to thank them. And I want you to know we are listening to experts as we think about reopening school. What we're going to do is what we've done the whole way. Identify a clear, comprehensive set of metrics and benchmarks that we need to hit in order to be confident that we're ready to reopen schools. And these experts have advised us on what those metrics will be. So I would like you to please put up a slide now. I'm going to go through those metrics. The slide shows 5 key focus areas that will indicate whether it's safe to move forward with most kids in person in school. Number 1, we're going to be looking at statewide data to make sure we're continuing to see good trends. We have to be in phase 3 or better for us to even consider having most kids learning in classroom. Number 2, we're going to look at municipal readiness. So this is going to have to be very customized, community by community. You know, we know Central Falls, for example, is in a very different place than many other communities. If we see an incidence rate above a particular level in a particular city or town, we're not going to move forward with a full reopening of schools in that municipality. And Dr. Alexander Scott is working with that team of health experts to evaluate exactly what number is most appropriate. And I expect we'll be back late this week or early next week with exactly what that number is. Third, we're looking at testing readiness. Right now, as you know, we're struggling with our testing time. It's still taking too long on average to people to get their test results. We need to have rapid turnaround of test results in every school if we're going to be able to safely reopen schools to primarily in-person learning. We need an average turnaround of at least 48 to 72 hours. Fourth, we need supply readiness. Every school has to have a more than sufficient supply of cleaning supplies, Purell, soap, hand sanitizer, masks, you know, whatever is required to keep teachers and students safe. You know, does every school have enough face masks to make sure that every teacher and every student has a face mask on at all times, even if someone left it at home by accident? And finally, we're looking at operational readiness. So this encompasses several key areas, which you can see at the screen. Does every school district have a comprehensive plan with multiple contingencies that was fully vetted by the Department of Health and Department of Education? Do these plans include all safety precautions that were outlined in the 34-page guidance document that was provided to districts by RIDE? They're very comprehensive. Safe transportation plans, plans for social distancing, plans for keeping kids in stable pods, accommodations for high-risk students, accommodations for teachers which have underlying health conditions and pre-existing conditions, etc. So these are the 5 areas which are on the screen before you that are going to be our focus as we go through the next 5 weeks to make sure that we can check the boxes in order to say, yes, it is safe for children in this particular school district to return to school in person. And if we don't check those boxes, then we won't allow it. I don't want anyone to worry that you're going to be asked or required to go back to school in person when it isn't safe, because that's not going to happen. We're not going to let that happen. I want to give you a little more information. Currently, on the reopeningri.com website, there's a 34-page guidance document outlining the specific parameters for each of the reopening options. Full in-person, partial in-person, limited, or fully remote. By this Friday, we're going to be posting all the plans for each district in Rhode Island, and Commissioner Infante Green is going to discuss that in a minute. By Monday, we'll be posting additional guidance document for all schools on health protocols, including how to screen for symptoms, how to determine when it's safe for a student or staff member to return to the classroom, and how to support the Department of Health with case investigations. The following week, I'll have more details around testing and transportation. And then the week of August 16th, we'll have our final recommendation on what level of reopening that we expect in each city and town. So what's the bottom line? The bottom line is schools are opening August 31st. Exactly what they look like when they open, we do not now know. We're going to make that assessment the week of August 16th. Between now and then, we're going to be working very closely with every school district to put all these contingency plans in place, and also to be monitoring the level of the disease in every city and town. And you can hold us to the criteria that's on the screen now. And I hope it gives you some comfort that we're not going to let kids go back to school unless and until it is safe. But I also want to point out that everything up here is doable. It's hard. It's very hard, but it is doable. And we owe it to our children to do everything we can to get as many of them back in school as possible. At the end of the day, this will be about choice. We're never going to force a parent to, force their children to be in school. Every district will always have to have a high quality distance learning virtual program. Our job, though, is to make it so that you're confident enough to send the kids to school. So this is where we are. I would say Rhode Island so far has done a very good job dealing with this crisis. We've done a very good job with summer camp. We're doing a great job with childcare. And I have every reason to believe that if we forget about the politics, forget about what's going on in other states around the country, forget about the president saying we're ignoring the science, turn all of that off. Focus right here. Children learn best in school. What does it take for this to happen safely? And how do we work hard over the next few weeks to make that happen? Be flexible, be patient, be calm, and let's work according to this timeline, and we'll make final decisions the week of the 16th. Lastly, I just wanted to very briefly acknowledge an announcement I made yesterday. Right now, there's so many people out of work in Rhode Island, and there's fear among many of them that they may never get back to work, especially if you're in an industry like retail or accommodation or hospitality that has been so hard hit. So yesterday, I announced that we'll be dedicating $45 million of our federal stimulus funds to train and support 5,000 to 7,000 Rhode Islanders who've lost their jobs in the COVID crisis. I want to thank our congressional delegation again for getting us that money. Here's the important part about this program. There's a guaranteed job at the end of it. This isn't getting training and hoping that you'll get a job. This is signing up. We have a website, Back to Work RI. If you're out there, if you've lost your job, if you're worried you might not be able to ever go back to your job, if you think you desperately want a new job but you don't have the skills, you don't know what you're going to do, go to the website, Back to Work RI. Sign yourself up for it. We're going to get you into training. We're going to give you job coaching. We're going to help you with your resume. And we have dozens of employers that have already promised to hire over 3,000 Rhode Islanders. So sign up, get through it, and there's a job at the end of the tunnel. We are going to rebuild this economy. We're going to get everyone back to work. We're going to get ourselves back to 3.5% unemployment, and we're going to be better and stronger and more resilient on the other side. That is my promise to you. Okay, I'm sorry that was long. There's a lot going on. I want to now turn it over to our commissioner.
Thank you, Governor. Once again, I will point out how much we appreciate your leadership. It is really important to us. Quería tomar esta oportunidad de dar las gracias a la gobernadora por su liderazgo. Rhode Island has been, and I want to emphasize this, and remains a leader ensuring education continues during COVID-19. Many states were struggling on how to figure it out. We didn't do that. We moved quickly. We looked at the numbers, we closed schools, and we moved to ensure that our students continued to get an education. How do we do that? We looked at the data. As you heard the governor, that's what we're going to continue to do. Como ustedes saben, nosotros en la nación nos están mirando porque pudimos poder darle instrucción a nuestros niños, no importando la pandemia. Nosotros hemos llegado a ese punto y vamos a seguir viendo los números y los datos. Es la forma que nosotros hemos movilizado. So we're going to continue to look at the data. As an educator, I agree with what the governor said. Our kids do 100% better when they're in school. We all know that. Como una educadora, sabemos que nuestros niños hacen mejor estando en las escuelas. But only if it's safe. I want everyone to understand that we are going to take the precautions and meet the metrics so that our kids can have a safe environment to return to. Queríamos decirle a los padres que nosotros sabemos que los niños hacen mejor en la escuela, pero solamente si va a ser seguro. Nadie va a poner los niños a riesgo. Nosotros vamos a mirar los datos. As a mom, I'm particularly grateful for the focus on testing readiness. All along, we have heard that the ability to quickly test and report results is a critical tool in combating the pandemic. We need to make sure testing is in place before any teacher or student enters the classroom. Nosotros hemos dicho que tenemos que tener los exámenes disponibles antes de nosotros empezar las escuelas. Nosotros estamos tomando todas las medidas necesarias. Now I want to talk to you about what's been happening in the last 2 weeks. My team at RIDE and the Department of Health have been working very hard together, looking at plans. The districts have done an amazing job of putting together as many safeguards and putting a plan that meets all the 4 parameters that we indicated. Because we have to be ready. Flexibility is the name of the game. So I want to personally thank the superintendents for thinking out of the box. We have some plans that are really spectacular, and we're going to share those. That's really important for us. But I think that the most important part is that we are looking at putting strong emphasis on ensuring plans that address the issues outlined in the reopening metrics that the governor just outlined. Para nosotros, las últimas 2 semanas, el Departamento de Educación y de Salud están trabajando juntos para darle información a los superintendentes, para guiarlo con los planes que ellos han puesto. Esos planes son sumamente importantes, pero ellos tienen 4 planes que tienen que hacer porque no sabemos cómo las escuelas se van a ver cuando empecemos el 31 de agosto. For example, we are ensuring our schools have adequate cleaning supplies, complete operational structure, including transportation, which has been hard, process to screen anyone that enters the school, and a detailed response protocol. All of these need to be in place for us to feel confident returning anyone to our schools. That is really important. Todas las medidas de transportación, de cómo tomar la temperatura o cómo vamos a medir, qué protocolos van a estar en las escuelas para asegurarnos que todo el mundo esté sano y salvo. Eso es parte del trabajo que se está llevando a cabo ahora mismo. We are now working with local leaders as they finalize the public version of their plans, which they will be posting to their website as soon as Friday. We're encouraging school leaders to stay engaged with their communities, as was part of the plan, to share details of the plan, listen to the concerns of teachers, families, and students, and adjust the plans as they learn more. Flexibility, 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 and the data and the numbers. And we have received many upon many emails from parents, teachers, both to the governor and I about, I'm concerned, I want my child to come back to school, I want things to be safe. We have read every single one of those emails. We hear you. We hear you. There is going to be flexibility. There's going to be options. Full in-person options, online options. There are going to be options. But like the governor said, we want to make sure that we are taking all the measures so kids can come back to school safely. Quería decirle que parte de lo que estamos haciendo es la flexibilidad. Nosotros estamos trabajando, los distritos el viernes van a poner su plan para que ustedes lo tengan accesible, para que ustedes vean que los planes son 4 que se están llevando a cabo, pero el medio de agosto el Departamento de Salud no va a decir cuál llevar a cabo. Pero es importante que ustedes entiendan que van a haber diferentes opciones, sumamente importante. Pero la opción de volver a la escuela va a estar ahí, aunque otros niños quieran volver, ir a distancia. Pero no, quiero que sepan que nadie va a volver a la escuela hasta que todo esté seguro y todas las medidas se hayan llevado a cabo. I would also like to give you the information that we have a new website. It's backtoschoolri.com. It's really exciting. We will be posting all the links to the districts, charter, and state-run school homepages. They will include the latest school-related information and tools, and the calendar of public event opportunities. Please join us. Please. Que hay un nuevo lugar que pueden ir que se llama backtoschoolri.com, donde pueden ver todos los planes de los distritos, están los distritos ahí y tenemos la lista de todas las oportunidades que van a haber para interactuar públicamente. Por favor, vengan, queremos oírlo. Nosotros hemos sido líderes y queremos seguir siendo líderes en la nación. As we said, we have been leaders and we want to continue to lead. And the way that we want to lead is providing our kids with a safe, high-quality education any way that we can, and that is our commitment to the community. So August 31st is when we start. You heard that on the 16th or 17th, we will make the commitment to which plan that we're going to be put in place. And they will morph and they will change based on what the community needs. As I said before, I'm a mother before I'm a commissioner. The metrics outlined by the governor today put health and safety first, as any mother would, Governor. Thank you. We hear it, we feel it. We all look at our kids while they sleep. We understand. La gobernadora hoy puso las metas que tenemos que lograr y como una madre, como todas las madres, nosotros vemos los niños que están durmiendo, nosotros los sentimos, lo entendemos. Nosotros vamos a seguir echando para adelante y mantener sus niños seguros. But we won't return anyone to the classroom until we meet all the metrics that the governor outlined and that we have confidence that every school can open safely. But no matter what scenario we use, our team at RIDE will stay on the job supporting local school leaders to make sure that the students continue learning this fall and throughout the school year. Any one of the scenarios, we're in this together and we will be successful. Quiero asegurarle que vamos a tener éxito porque estamos trabajando juntos y lo estamos oyendo. And now, before I turn it over to Dr. Alexander Scott, I'd like to thank her team and my team for working countless hours till 9 o'clock at night, almost every day. This is hard, guys. This is hard. And we're going to do it. Thank you, Dr. Alexander Scott.
Thank you, Commissioner and Governor as well. This is a critical effort, and we want all Rhode Islanders to know the strength of the team that's working to do what's best for all of you, so that you can also make the decisions to do what's best as well. To get started with the cases, briefly, we have 61 new cases to report today. We have 74 people currently hospitalized. 12 people are in an intensive care unit, and 6 of those 12 are on a ventilator. Sadly, we have 2 additional COVID-19 associated fatalities to report. 1 person was in their 80s and 1 person was in their 90s. Our sympathies and our prayers are with the families of these beloved Rhode Islanders. It's important for us to acknowledge that, because while our number of 61 cases today is a little lower than what we've seen over the last week, we are not out of the woods. It's critical for you to heed what the governor shared about the cases and what we are seeing. There is too much transmission going on right now, particularly tied to the social gatherings. We are addressing social gatherings at bars and restaurants where people are congregating together, not wearing masks, through the compliance orders that have been released. We need to address the social gatherings that you are attending, ensuring that people are wearing masks, even when it is family and loved ones. Transmission can occur when you're close together and you're not using the protective measures that we're talking about. Wearing masks is critical. Wearing masks is key. Backyard gatherings like barbecues, informal gatherings with families and friends, day trips, family celebrations where high-touch objects like serving utensils are being used. These are all examples of the scenarios that we are seeing cases increase and transmission occurring. And as the governor has shared, this is all preventable. We need people to wear masks, wear them appropriately over their nose and over their mouth. Too many people have told us that they could have done better in terms of wearing masks when we are reaching out to them about a new case that they have caused or been exposed to. And too many young people are identifying multiple close contacts. We need you, the 20-year-olds, the 30-year-olds, to heed what we are saying. Every activity, every gathering that you're attending with crowds, without masks, is impacting all of the work that we are doing painstakingly to make sure that people can return to work safely, can make sure that people can return to school where they need it safely. We need everyone to understand their responsibility. When you're at a party and it's feeling good and you're engaging with people that aren't wearing masks, everyone feels healthy and seems fine. That is exactly how COVID is transmitted. And it may take 2 or 3 weeks before it's known. At that point, it is too late. So we want to make sure that you hear us in understanding how critical this is. We are keeping our eyes focused on the prize with the governor's leadership and with the excellent commissioner and the RIDE team's work and leadership. Our focus is on being able to reopen the economy safely and to get children and people back into school and learning safely. But we can only do it with your contribution. I'm going to finish with, again, thanking the members of our expert team of advisors. Each of them have served as mentors to me, have been extremely valuable and critical throughout this entire response, and now are providing additional input on what we can do strategically and thoughtfully and carefully to advance reopening K through 12 and all that we need to across the education sector. So thank you to Dr. Dennehy, thank you to Dr. Mermel, thank you to Dr. Sharfstein, thank you to Dr. Weddle, thank you to Dr. Jha. We've also been welcoming and inviting additional experts from South Korea who joined with us yesterday, from Connecticut, from Maryland, other parts of the country. Rhode Islanders can know that we are being as systematic as we can to rely on the data and the science to move forward. Join with us to keep our eyes focused on the prize. With that, we're going to get started with questions.
Governor, good afternoon. Good afternoon. What's the science behind your decision going from 25 to 15?
2 things. One, signaling. You know, there's no magic number, but we learned when we went from 15 to 25, we started to see problems. And when they went through the deep case investigation of 4,000 people, the 4,000 cases, a lot of people couldn't remember how many people were at the party or the names of everyone at the party. We never saw that when the social distance limit, when the gathering limit was 15. So at 15, it's a manageable number of people. You pretty much remember who is there, and it's just generally more contained.
So you spent 10 minutes outlining your concerns with restaurants and bars, and Dr. Scott just reinforced some of that. What about protests? What's your directive to protesters? Keep it to 15? And how do you enforce that when you see large crowds? You're telling restaurants, you're going in and the DVR is citing restaurants. What's happening across the street here when you have hundreds, if not thousands of people gathering?
It's a great question, because I was quite worried when we had the big protests, whenever it was, a month or 2 ago, with 10,000 people. We saw almost no cases on account of these protests. Now, our theory is that that's because everyone had a mask on. So had we seen cases, we might be doing something different. But we've tracked these protests, and we haven't seen a lot of cases attributable to them. Now, we were there passing out masks. We are there passing out masks for all the protests. What we're finding is that when people party, they don't wear a mask, you know?
At the same time, your directive is no more than 15.
Correct.
So what about people who are deciding to gather as protesters? What do you tell them now?
Same thing. I think, look, it's a risk, and any gathering over 15, indoors or outdoors, is a risk. You should wear your mask. But what we have decided is that, you know, people have a First Amendment right to express their views. So we've enforced it, right? We've passed out masks, we've enforced distancing, but we haven't shut down any protests. And we haven't seen any cases, so I don't see any need to.
Just one other question while I have you shifting gears. 2 weeks ago, you said the application for small businesses would be ready in 2 weeks. Where are we on that?
Today, it goes up today.
And what goes up?
An application. So it'll be up online today, an application, start to fill it out. I believe Commerce is going to have folks available to help if you're a very small business and you need a hand. And they're hoping to start getting the money out the door, I think, next week.
Is it still first come, first serve?
Yes.
Shutting down a business, shutting down a business and as a result of not following procedures, I won't call it draconian, but is obviously a severe step and may end up resulting, unfortunately, in the death of that business. As such, are the folks who are inspectors, are they observing, if you will, police standards of evidence, due cause, probable cause, and what is the appeal process for this?
Yeah. So you'd have to ask Liz Tanner, who runs Department of Business Regulation. They have been excellent about due process. They have gone back on numerous occasions, giving warnings to the same establishments, offering assistance around how they can improve. And look, if after a couple of visits there's no improvement, then they're given their compliance order.
You're setting the specter of setting up tip lines, unfortunately, in today's heated climate, creates the specter, if you will, of folks diming each other out, neighbors telling on neighbors.
But it's very easy to fix it. Comply. Put up your plexiglass. Shut down your bar. You could fix it in a minute or a day.
Plenty of cases already, they're starting to surface anecdotally of he said, she said. So I'm just wondering, is there going to be an appeal process, and is this public information in terms of the evidence?
Yes, there is an appeal process. The metrics are online. The compliance orders are online. Everything is transparent. And by the way, for weeks, we have resisted this. The plan is not to shut businesses down. But the fact of the matter is we're seeing a problem. It relates to your question. This is where the cases are coming from. So we have to do something. Otherwise, we're going to have to claw back all businesses, and that's the last thing I want to do.
Dr. Alexander Scott, sort of going back to Jim's question on the science, are we seeing any trends where severe cases, maybe folks on ventilators, deaths, I know that's not the case, but in general, where these bar and restaurant situations or any other situations that are creating an unsafe dynamic are resulting in severe outcomes? Are we seeing an increase there, or are we sort of in the same place that we've been for the last few months, where the most severe outcomes are largely older folks?
As we've mentioned, hospitalizations have been slowly increasing, but are still on the low level. If you're considering hospitalizations, severe outcomes, there's oftentimes a lag when we see them, but we haven't seen as much of the change. What we are seeing is increases in cases among people who are 20 to 39 years old. Those cases are significant in the sense that the way COVID transmission works, someone may be infected, particularly if they're younger, they may not know it, but be exposing someone who is higher risk, someone who is more senior, someone who has underlying illnesses, whether or not they know it. And you don't have to be significantly older to fall into one of those categories, 40s, 50s, 60s. We would continue to see a trend with hospitalizations if we don't change what's happening right now. So that's what our critical point is today.
What's your message? There's this protest scheduled for Saturday. There are, I guess, by the standards here, they would be able to have 200 people gathered because it's an outdoor event, or 250, pardon me. Is there, going to be some sort of compliance officers there, or how are you, from a medical standpoint, sort of measuring how to handle an event of that nature?
Our key focus is for people to follow the rules. That's why we cannot emphasize enough that what is happening is preventable. Wearing a mask makes a difference. That's the bottom line we want everyone to understand. We've learned, we've evolved in our understanding through this pandemic. Wearing a mask absolutely makes a difference. If you're in a social gathering and people do not have on masks, if you have one on and you're not wearing it properly, covering your mouth and your nose, if you see a place where it's not happening properly, either remove yourself or encourage people. Get masks, give it out. If you're a business, offer it to people who are coming in. Wearing masks makes a difference.
Specifically to this protest, though, on Saturday or any other large scale events, you're comfortable with whatever number of people turn up as long as they're wearing masks and maintaining about 6 feet between each person?
As the governor shared as well, the larger the number, the higher the risk. Absolutely. So we want to always encourage smaller numbers. That's exactly why, particularly at social gatherings where we need people to wear masks better, we need that number to be as small as possible. Whether you're outside or indoors, the smaller the number, the better. No matter what, wear a mask. If you can distance, get the 6 feet of distance.
Can we talk a little bit about these numbers too, coming back to this? I mean, there are different ones when it comes to weddings, you have a certain set of numbers. Social gatherings, obviously defined differently, certain set of numbers, and then just indoor 125, outdoor 250. So you have people wondering what's the rationale behind these vast differences in these numbers. People had graduation parties planned for 40 people in their backyard, and then they can't have that, but a wedding can be out in the backyard with 40 people. So can you kind of explain that?
So yeah, I would say, first of all, as I've said from the very beginning, there's no easy, I'm always between a rock and a hard place. There's nothing perfect. We're trying to do our best. We are going by the nature of the event. So if you have an event where people are seated, wearing masks, you have the name and phone number of every person, it's outdoors, people are distanced, that you can obviously have more people. Where we're having our challenges are where there's lots of mingling, no mask wearing, no compliance. In your backyard, it's really hard for us to enforce anything. We've seen with catered events, compliance has been good. Waiters and waitresses are all wearing masks. They're encouraging guests to wear masks. They're encouraging social distancing. They have the names and phone numbers of everyone there. So when we do contact tracing, we can be very effective. So anyway, it's just really more about the nature of the events and how much mingling there is, how much hand sanitizing there is, how controlled the event is.
When you were also talking about schools, you made a comparison when it came to the number of positive tests, comparing that to the numbers of Florida, the numbers of Louisiana, Mississippi. Obviously, we're in a very different place than those states right now. Would a more accurate representation be comparing those to our other states in New England? And how is that comparison right now when it comes to opening schools and looking at those numbers?
I think it's similar. It's similar. Although we're also going to have to do a city by city analysis. So the 5 metrics I put out, we need to be in phase 3 as a state. And then each community has to be below a certain prevalence at the time we decide to reopen that week of August 16th, and then all the other metrics.
Explain a little bit the positive test rate, because we're seeing some different numbers, again, when it comes to the Johns Hopkins study versus what the state is releasing. When we get close to that 5%, what happens? As we're saying, positive rates of 5% in other states, you can't come to our state. So if we approach that, what happens, and what is the actual, can you explain that positivity rate by day?
Thank you. That's an excellent question. The percent positive number is one that is complex across the country. We've actually worked closely with COVID tracking, which is what Johns Hopkins references, to help them make sure we're comparing apples to apples. We are one of the few states that have shown different components to the calculation for calculating it in different ways. The way we have updated it so that it is most aligned with what other states are doing is the number of positive cases over the number of total people tested. That's more consistent with the states that are around, but we are still offering on our dashboard the other numbers that would allow for people to calculate the percent positive rate in the various formats that it can be done.
So what is the positive test rate as of right now for the state?
The 2% number that the governor shared for the state.
The city by city reference that the governor just made is I think where I wanted to focus a bit. There's a discussion in the slide in the proposals for reopening the state on municipal readiness. And that seems to me a potential ticking time bomb about health equity. Because, and to clarify, the governor talked about rates per 100,000 currently, but cumulative rates per 100,000 according to the state vary radically from city to city. So you have, on the one hand, something like 5,300 per 100,000 cases in Central Falls, 3,600 per 100,000 cases in Providence, and that goes down to 200 to 500 per 100,000 in the bedroom communities and suburbs. I think Hopkinton is the lowest with about 200 per 100,000. So logically, that suggests that if municipal readiness is a significant factor in what goes on in reopening the schools, I'm not saying it shouldn't be, does that lead to a conclusion that we're going to have very different types of school reopenings in different cities, which we may, but that the effect of doing it that way would be that the cities and the populations in those cities least able to adapt to, say, distance learning are the ones who are going to most need to stay distance learning. I mean, if Central Falls, being the hotspot, has to stay on complete distance learning, that's the city where people are more likely to live in multi-generational housing, where people are least likely to have access to fast internet, to laptops, et cetera. So are we, by putting municipal readiness as a criterion, and again, not that we shouldn't, creating a situation where the state is going to have to do something to provide for the increased needs from municipalities who have lower readiness? And
Yes.
what are we going to do?
Thank you for that question. This is something that we are focused on every single day. One of the first things I can respond to with your question was address the type of rate that we will be looking at rather than a cumulative, because each city and municipality has gone through its own journey. We will be looking at a weekly, a more recent case rate so that we can better evaluate where a municipality is at this time. And to combine what has already been shared, we want to encourage going back to school, and we want to look at all of the data to make sure that we are doing it in the safest way possible. Where there are municipalities or jurisdictions that may have higher numbers, that's going to be where we will focus additional energy and resources to be able to address. We have, for example, a high density setting support team that's analogous to the type of team that we had with congregate settings, where with partnership with the National Guard, partnership with the health equity zones and other community organizations, we're going into cities directly, municipalities that are hardest hit, ensuring that they have the resources to do the cleaning that's needed, to do the infection control changes that are needed, to be able to establish the testing that's needed. We will continue that type of focus as we are opening schools and help ensure that the municipalities that need the additional attention and resources to help ensure that their kids have the same access that kids do throughout the state, then that's what we will do.
Well, maybe the second half of my question would be better directed to the commissioner, in fact.
Yeah, so I'm glad you brought up this question because we have been planning on this but we've been looking at the numbers all along. So we have draft plans of what we're going to do differently in different communities. For example, Central Falls, you mentioned them. So what happens if they have to be at distance learning? So is there a way that we can help the family as a whole? Is there a way that there's additional tutoring, that there's additional supports? Our goal is to give more to those communities where they have been impacted the most. So it is not that they're just going to do distance learning. If that's the case, it's what are the other measures and supports that we can put in place to make sure that those students have the best education possible. And if that means getting the parents on as well and get them certified to do some work, we have the governor's program, all those things we've been looking at. The great thing about how our state has been tackling this is that we have been tackling it as a whole state. So all the agencies are working together to provide more to those communities that have been impacted. So we thought about the extra tutoring. We thought about how do we bring materials? What does the technology look like? Do we need to upgrade what's happening? All those things are part of our plan.
And finally, I'd like to direct a question specifically to the governor, which is if we do need to have additional resources that are provided to schools, is there money for that? What kind of money? Where can it come from? And do you have any comment on the situation with Congress currently negotiating the next installment of coronavirus pandemic aid? And to my understanding, the Senate Republican proposal includes almost no aid for schools unless they do in-person reopening.
Yeah. So we have allocated 50 million additionally to cities and towns to help them with the reopening. And our ability to do more than that will depend entirely on what Congress does. At the moment, it's a bit of a food fight in Washington, it would seem. And so we're just going to have to wait it out and hope that they do the right thing over the next couple of weeks.
Governor, you said you would never force a parent to send their child to school if they felt uncomfortable. The commissioner talked about flexibility. I just want to be sure that we're clear. Are you saying that even if the student doesn't have a health issue or is immunocompromised, if a parent doesn't want to send them back, even if districts are doing full in-person learning, that there's going to be an option for those families?
I think so, yes. Certainly initially. And here's why I say that. A couple of reasons. One, we've learned, we've been at this now for 5 months, 4 months. You need to folks have to get comfortable with it. So we saw the same thing with childcare and summer camp. Initially, some parents were reluctant, then they saw it was safe, it was happening, their friends' kids were there, and then they were able to send their children. I believe that that's the right way to do this, which is our job is to set it up, have it be safe, have an in-person option, and then give the parents some time to get comfortable rather than saying, if you don't show up, your kid's marked absent. The other thing is, here's the reality though, every school district, in order to have a complete plan, has to have a plan for distance learning. Because there's always going to be some kids on any given day who need distance learning. Maybe they're sick, maybe they tested positive, maybe they, just have the flu and they can't go to school, whatever. So in light of the fact that they have to have a plan anyway, and the fact that I think it's important for parents to have choice and get comfortable, I would say yes.
Based on the metrics that you released today, if Friday wasn't July 31st, if it was August 31st, would we be able to move into full in-person learning given the current situation that the state is in?
No, for a number of reasons. Number one, our testing capacity, our testing ability isn't quite there yet. So as I said, one of those metrics was we have to promise every school they can get the results of a test within 2 to 3 days. We'd be hard pressed we couldn't get that done next week. If school were starting next week, no. Also, the school districts aren't ready yet. By the way, I'm not criticizing them. They have more weeks to go. We've seen their plans, their draft plans. They're good, but they have a lot more work to do. So no, we have more work to do. But I think we'll get there.
I was just looking at the new website, and there's a great FAQ section. It looks like masks will be required for everybody all the time, regardless of pods, distancing, all of that?
Yes, we are going to require masks. This is something we are hearing from a lot of teachers. they would feel safer if the children had to wear masks. And I think it's important, teachers have to be safe and feel safe. So obviously, we don't want to get into mask shaming, and we don't want to punish children, and there'll be certain kids who aren't developmentally able to, so we have to be kind. We have to have extra masks in every school. So if a kid forgets one, you just offer a mask. Bottom line is everyone in the school should be masked.
Bouncing off that question, Massachusetts has mask breaks, designated breaks during the day, or designated areas where you can take a mask break. Is that something you're considering?
Yes, I think it's a good idea, particularly for the little kids, particularly for recess. Definitely. And that's my point. Like, all of the debate right now is so high level and political. Should they be in school or not? The reality is, yes, they should be. We have to make it safe. So then you get down to the nitty gritty details of how do you make it safe? What's a safe school bus? What's a safe mask break? What's a safe situation? And that's where I want to keep Rhode Island. That we have those metrics, we have the 34-page guidance document. Like, let's get to work and see what's possible and see if we can get the kids back in school.
Scott, just one more question. I've heard from some people that want to know about the health department, whether you're going to revisit the nursing home visits for people coming in from the outside. And, it started in June, but there are some places where they've had some positive COVID tests and then everything gets shut down. And so it's kind of a back and forth, a little bit of a seesaw. And they're talking about how difficult that is because you have a loved one who gets used to seeing somebody, then they start to regress because they have been alone for all of these months, husbands, wives, separated. And so I wonder what your directive is to administrators. In one case, they were concerned because they said they immediately shut down everything when really it wasn't the people coming in from the outside who were the problem. They have been some of the staff. So what is your directive to nursing home on visits when there are coronavirus cases found in that nursing home?
We decided to take it one step at a time. And that's why with starting visitation, we made it so that if there are cases, we want to really get our hands wrapped around it, stop visitation, make sure we understand what's going on. I'd like to continue that to make sure that we are controlling what's happening in the community overall, given the discussions that we've had today. But it is absolutely on the table, working with nursing homes to be able to see how can we move forward in a way that allows for more stability for people who are visiting. We've always known that there's a dynamic of the staffing who are from the community versus the visitors themselves, but being able to have control of the visitation, keeping it limited the way that it is, and then pulling back if we need to, just to assess if we have cases, works for right now. And we'll certainly come back to that to assess what's the next step.
I think their point is the reality is in some cases, not that the cure is worse than the problem, but you have some people who are literally dying because they're not having contact. And again, it's a 2 steps forward, 3 steps back situation. So I wonder at what point you're going to revisit that. It's been 6 weeks, almost 7 weeks, right, since you reopened for visiting.
That seems longer than what it is, but time is flying. So yeah, but it's something we're constantly concerned about. It's why it was challenging to go as long as we did without visitation, but we knew it was time to start. And I appreciate you asking that because we're going to stay vigilant at seeing how can we take it to the next step while keeping people safe.
Spring and out summer, but photos are surfacing. There's limited medical capacity out there, and we're seeing these
In Block Island? Is that what you're talking about?
on New Shore. Well, relatively limited medical capacity. What's your take on the ferry, though, as far as enforcement? Are DVR inspectors going to be out there looking at that? Is that something that's on your radar screen at this point? Have you seen those photos?
Everything is on our radar. For a while, we had problems, then we get it under control. It sounds like maybe we have to get back at it and look at it. You'd have to ask Director Tanner. I don't have a feel for it. Thank you.